Hello, and welcome to the Activ Doctors Online December webinar. The holidays are holly and jolly, but also potentially hazardous to your health. From winter weather to holiday stress, this webinar will touch on multiple health issues that can dampen your holiday spirit and how you can avoid them. Joining us today is Clinical Assistant Professor from Georgetown University and Activ Doctors Online's Medical Director, Dr. Howard Zahalsky. Dr. Zahalsky, welcome.
Thank you very much, Caitlin. I'm happy to be here. So let's get started. Today we're going to be talking about the holidays and particularly the health hazards associated with the holidays. Let's go on to our first slide. So today we're going to talk about surviving winter weather. Basically, the point of my talk today is going to be that I'm going to make you hate the holidays if you don't already. Why is it that the holidays can be so dangerous to your health? Well, there's a lot of reasons. There's the mechanical reasons, there's the infectious reasons, and then there's the emotional reasons, and finally, there's even the things that we do to ourselves. And on the first slide, we'll see the first of the health hazards to hit you in the winter. The fall. This is one of the biggest causes of winter weather-related illnesses and injuries out there, especially in older women. Do you know what the chances are of dying if you are an elderly person and you fall and you break your hip? You'd say, oh, why would that be so bad? You know, you can do surgery. It's actually pretty easy to do hip surgery nowadays. It's only an hour or so operation, and you can fix the hip right up. Well, the chance of dying after a fall and hip fracture for an elderly person in the first 6 months after the fall is 50%. Why is it? That's not actually that people die in surgery. It's all of the complications that go along with falling and breaking your hip. For instance, you end up being bedbound. This increases your risk of blood clots in your legs, which can travel to your lungs and kill you in what's called a pulmonary embolism. You end up having to go to a rehab center where there are a lot of other sick people, and you tend to catch a lot of illnesses from your neighbors in your room or in the rehab center. That leads to a lot of death. And just the rehab itself, when you break your hip, you have to get up and really work hard to get back to walking. Well, if you had a little bit of heart disease that you never knew about before, that puts a tremendous strain on your heart that you're exercising more than you may have in the last 10 years. Between all of these things, it is a tremendous risk of dying in the first 6 months after a hip fracture. So what can we do to prevent the hip fractures? If you are an older person, especially an older woman, a postmenopausal woman, give yourself the present of a bone density test before the holidays. Get checked for osteoporosis, and if necessary, get treated for osteoporosis and cut your risk of hip fracture. What are some of the other holiday hazards associated with the winter? And on the next slide, we'll see probably the single most common holiday health hazard, the dreaded upper respiratory tract infection. Everyone's always getting sick in the winter. Maybe it's because Aunt Carol was sneezing into her holiday ham. Maybe it's because Grandma was kissing and all of those cute little chubby cheeks of all of her runny-nosed grandkids. Upper respiratory tract infections knock millions of people out every holiday season. What can you do? Well, we're going to talk about hand washing in a minute, but the most serious of those winter upper respiratory tract infections is undoubtedly the flu. Make sure you get your flu shot every fall so that by the time winter rolls around, you're protected. It actually takes 4 to 6 weeks for those flu shots to kick in. So don't wait until December to start thinking about the flu shot. The peak of the flu is usually late December through early February. Get your flu shots in September and October. That way they're at full potency by the time the flu comes around. The other thing is the flu actually has an 8-day incubation period. That means there are people out there with the flu that look completely healthy for 8 days before they actually get sick. So just saying, well, I wasn't around anyone who had the flu doesn't mean you're protected. There could be a lot of people out there infecting you who they don't even know it and you can't possibly know it while you're actually catching the flu. But let's say that you got your flu shot or you missed the flu shot this year. What can you do come December to protect yourself from whether it be the flu or just regular colds? And as I said, the next thing we're going to talk about is hand washing. And that's on our next slide. Hand washing is very important. Washing your hands, scrubbing them with soap and water can go a long way to preventing any germs. But that's not how most people do it anymore, is it? Getting those little grandkids to wash their hands, next to impossible. And even you, as you're playing with all the kids, or maybe your own child has some runny nose or a cold, you don't have time to run to the bathroom every time you wipe their nose with a Kleenex. You need something quicker that can kill those germs. So what does everyone pull out of their purse? Purell. Everyone now walks around with a little container, especially in the winter months, of that alcohol-based waterless disinfectant that you can just rub on your hands, dries quickly, and you're off. The problem is Purell may be the worst possible thing to use. First of all, Purell, because it contains alcohol, dries out your hands tremendously. I have seen many, many people come into my office with horrendous rashes on their hand because they use Purell so much. In addition, believe it or not, Purell doesn't actually stop any of the things you're using it to stop. Purell and its antibacterial properties are good for stopping bacterial infections. So if you're in a hospital setting and you're worried that you're going to spread pneumonia or dangerous infections from one person to the next, Purell or other water-free hand sanitizers can be somewhat effective. But there have been studies done. In fact, there was one 2005 study that gave 300 families either plain alcohol as something to rub on their hands or Purell with all of its medical properties to use on their hands. And they found that even if the Purell people were instructed to use it multiple times a day, every time they came in contact with any other family member or any other person, the number of upper respiratory tract infections in the Purell versus the non-Purell families were exactly the same. In summary, the FDA has done a meta-study which showed that Purell does not stop upper respiratory tract infections. So it doesn't matter how much Purell you put on after playing with that little kid with a cold, it is not going to protect you. I also want to say something about antibacterial soaps. Using antibacterial soaps has not been shown to prevent any bacterial infections. The reason that soap and water works is because it literally scrubs and washes off the bacteria and the viruses and flushes them down your sink drain. It is not because the bacterial soap is actually stopping any infections. In fact, all you are doing if you use antibacterial soaps is making the bacteria that live on your skin and in your house resistant to the most common types of antibiotics. We are creating superbugs by using antibacterial soaps. So what's the smart thing to do? If you're worried you've been exposed to a bacteria or a virus, wash your hands with regular soap and water. Make sure you scrub them well and flush those bacteria and viruses down the drain. To try and take the easy way out with antibacterial soaps or Purell, you're just fooling yourself. You're not accomplishing anything. Let's go on to the next slide. No talk about holiday health hazards would be complete without a talk about generators inside the house. Now this is actually a picture of a safe generator to have in your house because I couldn't actually find a good slide of a picture of a generator that was dangerous to be inside the house. That's good, I guess. The point is, as the weather gets colder, more and more people, especially lower income people who may not have the money to pay their heating bills, find cheaper ways to heat their home. And one of those ways is you hook up a space heater to a gas-powered generator. For those who don't already know this, this is life-threateningly dangerous. Gasoline-powered generators create carbon monoxide that will kill you in your sleep. And there have been many tragic stories of entire families killed by carbon monoxide poisoning from gasoline-powered generators or diesel-powered generators in the home. So even if your lights go out, even if your heat goes out, even if you need a generator, please, please, please do not put a gasoline or diesel-powered generator in your home. The consequences could be life-threatening. All right, so those are some of the external factors: viruses, generators, bacterial infections. But what about the more internal factors that can be dangerous around the holidays, particularly the things that you could do to yourself? And one of the biggest ones is overeating. So we're now going to focus on healthy holiday eating. Is it even possible? Let's go on to the next slide. So on the next slide, we have a picture of what everyone wants, a piece of pie at whether it be Thanksgiving or Christmas dinner. And although this slide doesn't show it necessarily, usually this is the culmination of a large calorie-filled meal with mashed potatoes, sweet potatoes, ham or turkey, all sorts of side dishes, maybe some corn on the cob. And by the time you're done, you sit back in your easy chair, pat yourself on your growing belly with a satisfied, "Ugh," and tell your family how stuffed you are. Almost everybody overeats. Now, but it's not just the quantity of food. It's not even just the calories. It's not even just the fat that's in a lot of these foods and the gravies and the pies and the cakes. The biggest culprit is probably the salt. Salt is what makes everything taste good. Whenever you go out to a restaurant, you say, wow, their food really tastes better than I can make at home. The reason is it's the salt. Those sauces and salad dressings that you buy and those marinades that you buy for your steaks, they're all full of salt. Those luncheon meats that taste so much better than when you slice up a roasted turkey yourself, they're all full of salt. Salt, which is not at all good for your blood pressure and not at all good for your heart. So even if sometimes you can't avoid the calories, at least do a little bit to try and avoid some of the salt. Now, regardless, even if you manage to avoid the salt, that's not a license to eat whatever you want. And certainly if you're going to overeat on the holidays, you've got to make it up with some good diet and exercise the rest of the year, or you end up dramatically overweight, or as medically we like to put it, obesity. And on our next slide, we'll see some of these medical complications that can come from not just holiday overeating, but overeating in general. It can affect all sorts of parts of your body. When you gain too much weight, you can get sleep apnea from your throat collapsing. Too much fat can cause pancreatitis. There are various cancers that have been linked to obesity, not the least of which being breast cancer, because fat tissue in your body actually produces estrogen-like chemicals, which can make breast cancer grow faster. It can lead to gallbladder and gallstones. It can lead to gout. Over time, it can raise your blood pressure and lead to heart attacks and strokes. There are lots of good reasons to eat well, not just on the holidays, but the entire rest of the year as well. But if you are someone who already has a few extra pounds, being more careful over the holidays can be particularly important. On the next slide, I'm going to show you some of the problems that can happen from fats, which building up in your arteries. So this is what coronary artery disease is. Coronary artery disease is the cause of heart attacks. Over time, your blood vessels can get clogged to the point that blood can no longer flow to your heart, and this will lead to heart attacks. And what are these blockages made of? Here on the right side, you can see a little line pointing to a lipid deposit of plaque. What is a lipid deposit of plaque? You have lipids and you have plaques. Those are both medical code words for fat. Less fat, less plaque. Less fat, less lipids. Less fat, less cholesterol. So when looking over whether to have some of those mashed potatoes that grandma put some heavy cream in and about two 2 pounds of butter in to make them taste oh so good. Instead, maybe you should reach for the asparagus or the broccoli and see how those taste. Although Grandma probably sprinkled some salt on those too. All right, let's go on to the next slide. So far, we've been talking about medical complications, either medical complications of overeating, which you may have done to yourself, or medical complications of things like falls, which are more external factors. But there are some internal factors that oftentimes get overlooked around the holidays. These are, in particular, mental health issues, how we can save your sanity, or at least recognize the mental health problems around the holiday season. There are lots of reasons to be stressed over the holidays. You need more money for gifts. Maybe you've lost your job in the last year and you're trying to figure out how you're going to come up with all of that money. You're going to be seeing family that you may not have seen in a year or more. How are you going to deal with them? Oftentimes there's travel involved, and if you live in the northeast of the United States like I do, the thought of getting on those roads can be very stressful. So a lot of people go into the holidays thinking, wow, I feel mentally lousy, but it's to be expected because of all these stressors. But here we have a picture for someone who has more than just holiday stress. They might have seasonal affective disorder. What is seasonal affective disorder, or SAD? Seasonal affective disorder is winter-induced depression. It is more than just, wow, I can't deal with everything over the holiday season. It's a biochemical process whereby your body actually gets more depressed because of a lack of sunlight. People need sunlight. Owls are awake at night, but most mammals sleep during night and are awake during the day. Why is that? It's not just because we can see during the day and we can get more accomplished during the day. It's not just because our parents told us we have to go to sleep at night. There are biochemical reasons that mammals and their brains are programmed to be asleep at night and up during the day. Mammals need sunlight for their brains to function properly. There was a study done of nurses that found nurses who work the night shift and who sleep during the day are at higher risk of developing high blood pressure and heart attacks because your body does not work as well and does not perform as well when you don't get enough sunlight. Do not try and tough out seasonal affective disorder on your own. There are a lot of people who say, well, I get depressed during the holidays, but it's because of all these stressors, and I don't want to talk to my doctor about it. I'm just being weak. I just need to buck up and think my way out of my depression. When your emotions are not working properly, people see it as an internal weakness. No one sees diabetes as an internal weakness. No one says, wow, I shouldn't see the doctor about my diabetes because it just means I'm weak. I should be able to think my way out of diabetes. No one tries to think their way out of a stroke. But when people have depression, they tend to think, wow, this means I'm just weak and I need to think myself out of it. It's not weakness. These are biochemical problems created by changes in the relative amount of chemicals such as serotonin and norepinephrine in your brain. And when you don't get as much sunlight, in some people, the balance changes to a point where you develop clinical depression. And to just ignore it can lead to the problem that we'll see on the next slide. Suicide. These are suicide statistics for about 10 countries related to the time of the year. The United States, as you can see, is the green triangle. And if you follow the curve, you will see that the highest period for suicide in the United States is in December and January, when the days are short and there is less sunlight. On the other hand, the suicides are much less over the summer months. You'll see two curves that seem to go in the opposite direction. Why is that? These are countries, Australia and I think the other one is New Zealand, that are in the southern hemisphere. Their seasons are reversed. So they get more sunlight in what we would call winter, and their summer is in our winter, and our winter is in their summer. Throughout the world, the pattern is the same. When you have less sunlight, the biochemistry in your brain changes, and you are more at risk of depression and subsequently suicide. So if you or a loved one you notice is having problems emotionally, especially in the winter, don't tell them just to suck it up. Don't tell them, oh, it'll be better once spring comes around again. Don't tell them, don't worry, you'll get a new job, when the weather warms up. Treat this serious medical problem for what it is, a serious, potentially life-threatening medical condition, and make sure you or your loved ones get help if you notice the signs of seasonal affective disorder. There's another mental issue that can come out more in the holidays, and that we'll see on our next slide. Dementia. Here's a picture of a delightful elderly woman with multiple generations of family surrounding her. There's a lot of time that a lot of people don't see their elderly relatives except maybe for the holidays. And you come around on the holidays and you say, well, Mom may have slowed down a little bit in the last year, and I hadn't even noticed it. But you find excuses. You say, well, Mom's under a lot of stress because everyone's here visiting, or, oh, Mom had a cold about a month ago. Maybe she's still just recovering. Or Mom has so much to do. She's so tired because she really likes to cook. And you ignore the fact that her memory seems to be slipping. You ignore the fact that you go to eat the pie and you discover that she forgot to put the sugar in it, or that she stuffed the turkey with mashed potatoes instead of stuffing. That Mom must just be tired. But coming around for these holiday gatherings can be a way for you to notice if dementia, mild dementia, might be setting in. Now, dementia can be a very tricky thing, and if you heard our talk last month, we talked a little bit more about dementia. Long-term memory is usually the last to go. So Mom would be able to tell you exactly what goes into her chocolate mousse pie or her famous stuffing. She could even tell you that there's supposed to be 2.5 cups of apple in her stuffing. But if you ask her, well, did you remember to put the apple in this time? She might be less able to do so because the long-term memory stays. She remembers you. She remembers your birthday. She remembers exactly what happened 30 years ago. But she may forget the grandkids' names. These are not signs to be avoided, just like seasonal affective disorder. Don't let the fact that everyone's under a little bit more stress and everyone's a little bit more tired allow you to ignore serious medical issues that you're starting to notice. If you notice that Mom seems to be slowing down mentally, make sure she gets into the doctor once the holidays are over so she can be evaluated for dementia. Because there are certain things that can be done and medicines that can be given to slow down the process. And you don't want Mom to start forgetting more people in the family because you wanted to make apologies for her over the holiday season. So those are some of the biggest holiday risks to your health that can happen or be noticed over the holiday season. And on the next slide, I'm going to tell you how Activ Doctors Online can help you get through the holiday season. We have several different solutions that are able to improve your health both over the holidays and year-round. With our personal health records, it can allow you to keep better track of your medical records, and especially if you have elderly relatives whose records you may be following from afar, it can allow you to keep track of everything that's going on with Mom or Dad's health over the computer without having to keep being on the phone with their doctors. Should you notice that a serious problem is developing and you want a second opinion, our e-consultation system will allow you to get a second opinion through our electronic personal health records from some of our top experts all around the country and all around the world. And finally, with our e-consultation system, if your doctor is a member, over the holidays where it might be difficult to get to the doctor, we can help you and your doctor arrange for consultations over the computer so that if there's something you're worried about, you can have a conversation with your doctor without both of you being in the same place.
Thank you, Dr. Zahalsky. Here at Activ Doctors Online, our vision is to Reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. Our vision is to educate, engage, and empower our members to take control of their health destiny, to save time, money, and in some cases, lives. We invite you to try Activ Doctors Online free for 30 days. Simply head on over to our website, www.activdoctorsonline.com, and click Get Started. If you would like more information about the webinar, would like to schedule a demonstration of our unique health platform, or have any questions about the certs, please feel free to contact Dr. Zahalsky or myself directly using contact@activdoctors.com. You can also reach us on social media. Find us on Twitter @Activ Doctors and on Facebook and LinkedIn @Activ Doctors Online. Thanks for watching, and we hope you'll join us next month for another informative health webinar. And from all of us here at Activ Doctors Online, have a happy, safe, and healthy holiday season.